surgery is very, very interesting to me. I think that just our ability to be able to take someone and physically alter them in a way that makes them better is just amazing, amazing.
Right.
In the case of, I don't know if this is so much the case with hand, but I know with general orthopedics, you are physically putting in other things also. Just quickly for my curiosity, are you using lots of implants for hand surgery, or is that not really?
We don't. So for us, for example, I have a case coming up next week. I think it's a fusion of a finger where I literally put in some they're basically pins, we'll say, that will stay in to fuse a joint. And a gentleman has had a dislocation now for I think like 8 or 9 months. He just didn't want to have it treated. So now he has to fuse the joint. But there are some injuries, for example, or some types of comorbidities, for example, rheumatoid arthritis. Sometimes they will put in implants for the joints. I'm not necessarily a fan of those, but sometimes they will do that. I'm not a fan of that, though. I'm not a fan, but some people do it. I think if you talk to 5 different physicians, you're going to get 5 different answers because we're all very different, like everyone is, you know. In my mind, I always try to do things that are minimally invasive, that will give the best thing to optimize the patient's health, to get them back to function, and to get them back to work and living the life that they were living before the injury. Because when people are injured, it's really traumatic for them. You know, you do treat the physical, but even as an orthopedic surgeon, I'm always keenly aware of the psychological trauma that a person has had from, an amputation of a finger, for example, a severe back injury, a spinal injury, or if they went from walking and now they're paraplegic and now they have clawing of their fingers from the spinal cord injury. I'm really aware that you really want to consider the psychological impact and then getting them that proper care to speak to a psychologist or psychiatrist and to remind them that it's okay. It's okay if you're hurting. It's okay if you're feeling this sense of, post-traumatic stress or anxiety or depression even, so I'm just really aware of that. You have to treat the whole patient. I hope you remember that. Don't just simply treat the injury. If they have a wrist injury or have a headache, you want to go deeper to find out what else is going on that you can help them to be on a healthy journey of self-awareness and fitness.
Yeah, especially if someone has been, like, doing sports at a high level and they get injured, that is crushing.
It really is crushing. Almost 2 years ago now, I had a really bad injury. I'm still going to rehab for it, actually. It was really severe. It was a blow to my mind that I couldn't use my body the way I've used it for so many years without any issue. And to literally be in a wheelchair for a little bit and then on a walker, a cam walker boot thing, and then a scooter, it was really, really intense.